Good afternoon, everyone, and thanks for joining today's webinar focusing on COVID-19 and dentistry, coding for teledentistry, billing for PPE, and in-office testing. My name is Adam, Content Marketing Specialist with Schein, and I'll be your moderator for today's presentation. If you have questions, please type them into the Q&A section of your control panel, and we will be sure to cover them throughout the webinar. We're fortunate to have Delane on with us answering questions during the presentation. Delane is the call center supervisor for practicebooster.com, and she is available to answer your questions in the Q&A. There will also be live Q&A at the end with Dr. Blair as time permits. Please make sure that your volume is up and any large computer applications are closed to ensure a smooth connection. This webinar is presented by Schein Dental, and no CE credits are being offered for viewing this presentation. Our speaker today is Dr. Charles Blair. Dr. Charles Blair and Associates specializes in providing highly effective, customized consultations to individual doctors and staff who want to maximize practice profitability and personal income through sound, proven business strategies. Thank you, Dr. Blair, for being here today. Over to you.
Okay. Well, thank you so much, Adam, and a pleasure to be here today. I noticed we're up almost 2,000 participants, just a few shy. And so my pleasure today to present a program for Schein. We're going to be covering the teledentistry area, the PPE area, in-office testing, and stay tuned, a few extras beside that. Before I get started, I do have a couple of disclaimers. First is I'm not a healthcare attorney. I'll give you my opinion on some things, but we're not giving any kind of legal advice today. Also, a disclaimer as far as my strategies. We've really researched this heavily, but it doesn't mean that what I have to say is going to apply to a given plan. Gosh, there's so many variations out here. So there's no guarantee that some particular strategy that I talk about is going to necessarily reimburse. Also, the ADA's mantra is always code what you do. So it's up to the dentist to put down on the claim form, what did you do today? If you did a pan and bite wings, that's what you put down. You do not put down a full series as an example. Also, I know we've got associate doctors listening today, some non-owners. I want to tell you who signs the claim form. It's not the owner. So the practice itself is the billing entity. But who signs that form? It's not Mary at the front desk. It's the doctor who did the treatment or who supervised the hygienist. So keep in mind that the responsibility is for the dentist to code what you do. Also, you want to follow the current CDT code set exactly to the best of your ability. And so there are some great resources. One resource I wanted to tell you about is that the ADA has a code companion. Many people don't know about that. I think everybody knows that the ADA has a code book, but I would highly, highly recommend that you get the companion. It has some excellent, excellent material. Also, that is God speaking. So the ADA, the Council on Dental Benefits, the Code Maintenance Committee, this is God. And so it's not Charles Blair. It's not necessarily AGD or the Periodontal Association or the Hygiene Association, but we look to the Council on Dental Benefits. We look at that book, and that book is kind of God speaking. So that gives us some tremendously great guidelines. So always code what you do, and remember that the doctor must select the code that's most appropriate and determine what goes in on that claim. I want to warn you something here, folks. Wow, a changing landscape. So if you heard me do a webinar a week ago, 2 weeks ago, you may find that there's a few changes today. If you hear me give this program 2 weeks from now, there may be some changes. So this webinar is current as of today, the 12th. So we've got a terrific changing landscape with COVID out here. And so you want to check constantly with the ADA website, and they have a section there where you can look at the latest in coding and see what that is. So that's our guideline. And so please check that on often basis. What am I trying to do today? I want to simplify this thing. Folks, the chat rooms are famous out here with all kinds of stuff going on. We monitor that. And I want to try to simplify. The ADA list on the website a variety of codes that might apply to teledentistry. That's true. But I want to boil that down to which of the codes, if there is a code, might be better for reimbursement, what might be, a little better. So I want to try to decrease some of the confusion that's out there regarding teledentistry, PPE, and testing in office. So who do we look toward? The ADA has got some terrific COVID practice resources. Look to your state dental society, and then your malpractice insurance company. You need to check with them, see if there's any particular guidelines right now with this pandemic. And of course, your state board. Check often with the state board. Also, you need to check and see if teledentistry is legal in your state. Teledentistry is illegal in a number of states, but things are getting better, and more to come about that. So, what codes might apply to a virtual appointment? How might that work? Well, we actually have two codes for teledentistry. And the first one is 9995. It's synchronous. It's a real-time encounter. Folks, this is the one we're talking about today primarily. The other teledentistry code is where information is stored and then forwarded to a dentist for subsequent review. For instance, maybe there is a outlying rural area, and a hygienist or a dentist is out there and they want to send some information to the dental school to have a specialist maybe look at their materials and so forth. That's where the 9996 might come into play. That code is just not going to be playing today. Which one really applies for that live interaction between the patient and the dentist? And it is 9995. It's synchronous. It's a real-time encounter. Now, what about teledentistry within the office between the dentist and the hygienist? Could the hygienist be down the hallway and then we're going to some way use teledentistry codes? And the answer is no. It does not apply to any type of thing between the dentist and the hygienist and so forth in the office. Now, is it legal? What about teledentistry? Is it legal? And what we're talking about here is billing. It is illegal in a number of states. The trend is positive, so don't please ask on your Q&As, what about my state? Please just call your state board, check with your state board. It's getting more positive. Now, it's always been legal to talk to a patient. Any dentist could call a patient, talk to them, the staff could talk to the patient. But what we're talking about is talking to the patient and then billing for that, a billing cost for that. That's what we mean by the teledentistry being legal or illegal. We're talking about billing. And I think it's roughly about 10 states right now where it is illegal. But the trend is positive. So I'm going to give you today the trends on a lot of this. Is it positive? Is it just not getting much traction? So how would we deal with 9995 on the dental claim form? And there's several pitfalls. The first thing is place the service that's rendered. I'm going to use as an example code B0140, and I have a lot of repetition in here. So that ought to be a tip-off right now. I'm talking about code 0140, and I'm going to give you a tip-off of several times mentioning that particular code. So on the claim form, we would enter D0140, and we would enter D9995. Now, in addition, we must have a place of service. There's about 80 places of services. And so there's a hospital, there's a nursing home, there's your dental office. By default, your dentrix right now, if you look at the claim form, the place of service is 11, or the place of treatment, whatever we want to call it, it's 11. And so the place of service is 02. So we need 9995 and we need 02. Some of your softwares, and again, you may have a fee for 9995, you may leave it blank, and in certain cases, software may not transmit a 0 fee. So you may need to check with your Dentrix, your EagleSoft, your Open Dental, and that type of thing. There's one other thing that comes into play, is that if you look at the claim form, over to the left is the billing entity and the address, and that's where the check comes. But under the provider is a address, and that's box 56. That's the address of treatment. So an example would be a pediatric dentist goes to the hospital, and the place of service is going to be the hospital. The address is going to be the hospital address under the provider's name in box 56. So technically, if the doctor is doing teledentistry from home and calling the patient from home, not in the dental office, technically on the claim form would be the dentist home address in box 56. So just a few nuances about the claim form. What about charging a separate fee for 9995? Well, the short answer is a fee can be charged, but currently the reimbursement right now is extremely low. Plus, is it even piling on to even charge a fee? So stay tuned. I'm going to give you strategies later as to whether you want to charge for a given code or not. So stay tuned, because we will be talking strategy later of which of these codes, just because there's a code, do we want to charge for it? Or do we want it to be value added? Now the ADA, if you go to their website, they list a number of codes as far as teledentistry coding of what are the possibilities. Code 140, we're all familiar with that. That's the limited oral exam, problem focused. Many of us call it, that's the emergency exam. What about the coverage? Well, the payers, they have excellent coverage of this particular code. There's another code. We don't see it used very much. Typical practice might use it 5, 6, 7 times a year. It's a re-exam. It's limited, problem-focused, and established patient. An example of this code might be a child comes in today, has trauma. They've got a busted lip. I examined the kid. He's got a couple of mobile teeth. Number 8, number 9 have a little bit of mobility, not enough to strap him up or send him to the oral surgeon. But I tell the mom, I say, look, let's get Johnny back. He's had trauma today. I want to check these teeth. I want them to tighten up. They've got a little bit of mobility. I want to see Johnny in 4 weeks. What kind of exam would that be? Code 170. I'm focusing just on what I preliminarily had discussed or discovered. A second example might be a lesion today. Could be a new patient, could be a checkup. And I have the patient come back in 6 weeks. I say, you know, this may disappear. And let's take a picture today. I don't want to wait 6 months. Let's get you back in 5, 6 weeks. So they come back. I focus just on the lesion. So that's an example of a re-exam, code 170. Another code that was mentioned as a possibility is 171. And this is a re-exam. It's post-operative. It's an office visit. An example of this might be patient comes, I pulled a tooth last week, I put a suture in, they're coming back this week, I'm checking healing, I'm removing the suture. That's a 171. 171 is typically no charge. It could be a denture adjustment. It could be, I did a fill-in last week. The fill-in's a little high. This week they're coming back, I'm adjusting it. That's on my nickel. That's a 171. So I'm going to give them a walkout statement today showing no charge. We're not going to turn it into insurance because there is no charge for that. What about the coverage for 171? Not so good. Remember, there's about 6, 7 various evaluation codes. Well, what about a couple more codes that are mentioned? Code 190. This is the screening of a patient, and this determines the need to be seen by a dentist for diagnosis. An example of this might be a hygienist out in a school system or where it's permitted and by law. Someone screens the patient with a tongue blade, looks in there and says, ooh, these teeth don't look good. Let's send you to the dentist for a definitive diagnosis and treatment plan. Also, we have unspecified procedures. Remember, these 999 codes must be by report. We've got to write a narrative. Understand that narratives on the dental claim cannot exceed about 80 characters and be guaranteed to get transmitted completely to the payer. So 0999, that's an unspecified diagnostic procedure. And again, normally, we're just not going to see reimbursement on that particular code. I think it's very important for me to look at the codes here, to discuss the codes with you, and kind of cut to the chase of which particular codes might be the better code to use if you could report truthfully and accurately. What if it's audio means only? Well, if we're just calling the patient, that's a screening. Or it's a 9999. So just talking over the phone, there's no visual component is a key in this. So keep in mind that if it's just pure audio, that we could not report code 0140 as an example. So what about in a call center? Well, maybe screening of a patient, and poor, none. 09999, again, none. And again, do you even want to be charging for somebody, for them to be talking to somebody? So, is there an evaluation code available that we might want to report? And so, yes, we would look at these 3 codes and determine that, hey, out of these possible codes, and I've already discussed them to some degree here, is one of these procedure codes superior for the best reimbursement coverage overall by the most payers that are out there? Is there a code that has a higher UCR than maybe for some of the other evaluations that are mentioned here? Yes, code 0140 is the overall winner. This is our limited oral exam, problem focused, but let me tell you, we've got to qualify this code. So we've got to qualify the code in order to bill out the code. Now, as far as the limitations, do we have limitations on exams? Yes, the typical payer, a typical policy in the plan document, they outline that 2 exams or evaluations is the highfalutin name. 2 evaluations are paid per calendar year, or 1 evaluation per 6-month period. Now, there's a very few payers that may cover 2 emergency visits plus 2 routine checkup exams and so forth. So with COVID-19, what are the current limitations for evaluations? Well, this is a changing ballgame, again, to say the least. And we see some of the payers now have waived these traditional limits. In other words, that traditional limit of 2 evaluations per year, now they may cover 4 evaluations. But the caveat is generally it is for a limited period of time. So some of the payers right now have said we will pay for a couple more evaluations at this point in time. That doesn't mean indefinitely, and in many cases, it's at this point maybe for just a couple of months. So let's see how this plays out. What other codes have been mentioned for consideration? Well, what about the office visit? This code's been around about 100 years. It's D9440. It's an office visit after regularly scheduled hours. Now, there's some caveats to this code. It requires that the dentist comes back and reopens the office after hours. And we would report this in addition to services rendered in the office. I say the reimbursement is rare. It's not very much. But for instance, there's a Delta Hawaii Dental Service out in Hawaii. They cover this. But be careful, folks. Don't abuse this code. It requires that the dentist return to reopen the office. The payers are looking at this right now, those that do cover the code, for any abuse. For instance, we know of a dentist that would appoint the emergency patient at the end of the day, and his normal hours were 8 to 5, and so he sees the patient at 5:15. Oh, that's outside my working hours. I'm going to charge 9,440. No, the dentist never left the office. So don't abuse the code right here. Another abuse would be to say, right now during COVID, I'm going to have emergency hours on Tuesday and Thursday. It's 8 to 5, Tuesday and Thursday. So I'm going to charge 9,440 to all those patients on Tuesday and Thursday. Again, an abuse and not proper use of this code. On the other hand, right now, if I'm only open on Tuesday and Thursday for an emergency basis, what if I went in on Monday and a patient was in severe pain? I go in, I open up the office on Monday specifically for that patient. Yes, that's code 9440. Remember, if you're in a PPO, we must report all charges. I'll get to that a little bit later. So we must disclose all charges if I'm in a PPO. How do I know that? Where do I find that? Well, every PPO has a contract, but every PPO has a processing policy manual. It's in the processing policy manuals, and that's kind of the handcuffs. And so many offices, they know about the contract, they do not know about the processing policy manual. And so we must give the PPO all charges of the patient. You wouldn't think about it, but even cosmetics. I do tooth whitening today. Do I have to turn that in? Yes. Technically, if it's a PPO, we're supposed to report all charges. Are they going to pay it? No, but they could fee cap for non-covered procedures. So stay tuned. What about another code that's been mentioned for teledentistry? It's 9992. It's dental case management. It's care coordination. I'm not going to read the slide here. You can read this on your own. So what about this code? Well, it reports a consultation between the dentist and, say, the patient's physician. What if I call the patient's physician? I burn a half hour talking to the physician. Could that be reported in some way? We do have a code to report it. Is it going to be paid? That's a different story. So this case management fee, very, very little coverage, but hey, we see some coverage there. And the trend, though, does not seem to be positive for coverage at this point. But we do see a few payers that are paying for the case management fee at this time. So what about the summary? Let's summarize the teledentistry billing codes. I've covered the best codes to report based on reimbursement and the UCR. So what about charging patients for the various teledentistry reported codes? Should we not? Let's take a look at some things. So what is the best code overall to charge the patient? Again, code 140. It seems to be the best bet. The coverage trend is improving. Like I said, some of the payers are now adding some additional evaluations to the normal 2 exams a year. We're now seeing as many as 4 evaluations a year. And so some payers right now are increasing that frequency limitation. But remember, if you look at the ADA website, code 140, it has an audio and a visual component to report. So if I'm calling the patient, I cannot code out code 0140 with just a pure audio. I've got to have looking at the patient or having photographs of the patient. There must be a visual component to report code 0140. Should you even charge for code 140? Let's take a look at this. For long-time patients, some dentists may be reluctant, but do keep in mind that insurance reimbursement is very good for this code. For new patients, some dentists may choose to charge. It's the dentist's choice as to charge your standard fee. Let me say though, you need to have a consistency here. In other words, if my policy is for patients of record, I'm not going to charge, but if they're a stranger, I am, that's fine. But notice I'm not hedging the bet. I'm not saying, well, if they have insurance, I do it this way. If it's Delta, I do it that way. If it's Guardian, or well, if they are cash, I treat them this way. Notice I didn't hedge. What I said was, if you want a policy across the board, we charge an exam if it's a stranger, but if it's a patient of record, we're seeing them every 6 months, we don't. So be sure that you do an across the board charge. Now, listen carefully. It's really important to listen to what I'm saying today, because you might hear something and you kind of hear what you want to hear. So that's why I would urge those folks listening, please listen to this presentation one more time. You may pick up some nuances. Also, what's great, if you've got another person in the office, so that a couple people from the same office could hear the presentation, you then could compare notes. What I'm saying is right now, related to teledentistry, the copays and deductibles may be forgiven. So it's legal to do copay and deductible routine forgiveness. Usually routine copay deductible forgiveness is a no-no and something we don't do, but in this case, related to teledentistry. Now in dentistry, we know that we don't see a lot of deductibles and copays in regards to say code 140, but it can occur because if a patient is out of network, in some cases, they must pay a deductible or a copay. And so it could come into play. So the doctor can forget or forgive and write off copays and deductibles temporarily on the teledentistry. When the patient comes in the office, understand me, no. So when they come in the office for treatment, we cannot do copay and deductible forgiveness. So understand what I am saying. We've got here the resource of where you can check this out. What about charging for the teledentistry code 9995? What would we charge? What would be the fee? Should we not? Well, it's not typically covered, but a charge is permitted. And we are seeing a bit more of an uptick. There's very limited coverage at this time, but some coverage. And the fees that we're seeing is around $12 to $15. So we are seeing some limited coverage with some of the payers. You know, something that might come into play is the practice paying a separate teledentistry fee. Are you using a third party for teledentistry services? Are you paying for that? Then possibly you might consider a fee. So we do see charges out here. At the end of the day, again, it's up to the dentist. Another consideration, is it piling on? If I charge a fee for $99.95 in addition to code 0140. Again, if I'm going to charge for something, I'd like to charge code 0140. It's got the best odds of reimbursement, like I've said. So the dentist will have to decide if you do want to charge that $99.95 fee in addition to code 0140. It's up to the dentist. What about this dental case management 9992? This reports the dentist, again, consulting with the patient's physician At present, it's fairly rarely covered, although we are seeing some coverage, and there may be a slight uptick possibly right now, and possibly it's just a temporary thing, who knows. So do you want to charge this additional fee? Is it piling on to charge for multiple codes with this teledentistry? So at the end of the day, the dentist must decide the appropriate charge for the most appropriate situation that we're talking about here today. So let's discuss next what kind of technology is allowed for teledentistry. And there are some specifics. Non-public communication platforms that are allowed would be smartphones, Apple FaceTime, Skype, Google Hangouts, Zoom, Facebook, Video Messenger. Not allowed would be Instagram, Facebook Live, TikTok. This is not a complete list here. Another thing, if you're going to do the technology, the teledentistry, you really need an informed consent. And on the ADA website, you will find an informed consent form there that you could use for the patient. I don't think, that, again, it may be that your malpractice carrier might require that. So they do have a nice little form if you want to use that, and it's freely available on the ADA website. So temporarily, HHS is waiving potential HIPAA penalties. Let's face it, I'm doing a video with a patient. They're in their home. They got a neighbor over. They got other people sitting around the living room. Who knows? And so all of that would be potential HIPAA penalties or violations and so forth. So right now, it's kind of a free ball game out there in regards to what you're doing. And after all, we're just talking about a dental situation here, not something that might be held back. So here's some references for the types of technology that is allowed. So how do we document teledentistry? If I call the patient, I've got the audio component, I've got the visual component. What about the documentation? So in the patient record, we're going to enter the teledentistry code. We're going to enter in the patient record the evaluation, say it's code 0140. We want to record in the record any aspects of the audio conversation provided by the patient to conduct this evaluation. Now remember, some of the state boards say this is illegal. They say, okay, you can't charge for any exam unless your hand's in the mouth. So like I said, there are a few states, could be as many as 10, that still it's illegal to charge for teledentistry. So check with your state board. In the patient record, we want to document the reason for the encounter, the diagnosis, the condition of the patient. This establishes the emergent need for telehealth. And some patients may transmit photos to you to assist in their diagnosis and treatment. Again, you want to put all of that in a secure location to become a part of their clinical record. So be sure that you have the clinical patient record to back up the teledentistry interaction you've had with the patient. Okay, I've given you some highlights of the teledentistry coding, which code overall will be the best one. Be sure, again, on code 0140, you have both a audio and visual component to that if you are going to charge that code out. Let's move our thinking now. Let's think about personal protection equipment. Wow. Carson Carpenter had a fabulous webinar the other day, and I learned a heck of a lot about it, about PPE. And as we know, it's a significant expense. We know also right now, a lot of it is overpriced out there. and it's not a commodity. But I think about another 4 to 6 weeks, we'll see a lot of commodity pricing on a lot of the PPE. So, and we charge separately for the personal protection equipment. ADA says yes. So on the ADA website, they're saying that yes, you could charge a separate fee. How do we do that? Is there a code for PPE? The answer is no. There is no code. There's not a specific code. And so we want to report B19999. That's an unspecified preventive procedure with a narrative. And remember, narratives cannot be more than 80 characters. If we get more than 80 characters, we need to do an action. We want to document the PPE in the visit notes. You may want to set up an auto notes on this of what it is. I know I was talking with an office this afternoon. They say that they put in the 19999 and they are doing an attachment with, they say that the narrative's not enough, 80 characters, to really indicate exactly what all they're doing. So they're doing an attachment to the claim. So you want to document the PPE in the visit notes. Remember that your PPO processing policy manual, every PPO has a contract, every PPO has a processing policy manual, and even Medicaid has a processing policy manual. Note that Delta Dental has 2 processing policy manuals. I'm here in North Carolina. There's North Carolina Delta Dental. So if a patient comes in with Delta coverage and the policy was written in North Carolina, that's under the North Carolina Processing Policy Manual. But what if a Walmart employee comes in? Walmart down in Alabama, they sign a national contract with Delta Dental Plans of America. And so there is a different manual, and it's Delta USA. Where do you get these manuals? You go to the PPO's website. A lot of times it's password protected. You download these processing policy manuals. They can be a couple hundred pages. The 2 Delta manuals are fairly close to each other, but not exact. That's where we find out all kinds of things. And in the PPO manual, every one I've ever read says all charges, every charge has to the patient must be submitted to the PPO for review. So this 19999 charge, I can't cut a separate deal with the patient on the side and charge them if it is a PPO. Now, if I'm in network, I've got to do what the processing policy manual says. So I've got to turn it in. When I turn it in, carefully look at the EOB. The PPO can deny a procedure. That means that the patient pays and the PPO doesn't. Or they can disallow, or you must write it off. So if you're in a PPO, you do have some handcuffs. You've got to submit it, and then you look at the EOB and see exactly how the PPO is going to handle that. So you can see what they're going to do. We think that a good many will probably disallow this, but stay tuned because we just don't have a trend specifically. Now, what if I'm out of network? There's a couple of options. I could simply raise my fee if I'm out of network and the patient pays my fee. Or I could tell the patient there is a separate fee and inform the patient and then charge the fee. And so if I'm out of network, I'm always going to get the fee. But if I'm in network, again, I've got some handcuffs and I've got to abide by what the PPO processing policy manual says. It's the conduct is with your state boards and so forth. You've got problems if you don't abide by contracts as a practicing dentist. And so you don't want to run into issues here. So you're supposed to abide by the PPO contract and the processing policy manual. Now, I want you to know something else about PPE. Some payers, for a limited time, are paying separately a $10 fee per unique patient visit monthly, and no billing is required. For instance, I'm aware of at least 3 Deltas. The way they work, you've got to be an in-network doctor, and so they keep a tally during the month of how many Delta patients did you see, how many encounters, and then multiply that by $10, and then Delta is paying a separate fee. I am aware of at least 3 Deltas that are doing it on that basis, and there's probably other payers out there that are just going to pay a separate fee in the billing, maybe at the end of the month. Other is some of the payers are offering maybe a rebate. They're saying, we know that times are tough. We know you've got some PPE expenses. So we're going to take, if you did $200,000 last year with us, then we're going to cut you a check for $2,000, 1% rebate, and this will help you. This can offset. So this is a little different approach on PPE, and it's a little different twist in terms of the PPE reimbursements. So at the end of the day, it's up to the doctor just how you're going to charge it. I've given you some avenues here for charging separately for the PPE, and it's up to you of what the fee is going to be. But remember, at the end of the day, the PPO does control charging for that fee. Okay, the last subject matter that I want to talk about today is in-office lab testing. And I think that this is going to come forward. We don't know how much of this is going to go on, but I wanted to put this on your radar because, again, we're picking up chat room talk. We're picking up some things that is wrong out there. And so I want to kind of give you the latest on in-office lab testing. First of all, a dental office that performs in-office testing, you are a laboratory and you must register under Clinical Laboratory Improvement Amendments, CLIA. This means you've got to obtain what's called a certificate of waiver. This is the lowest level category of a testing laboratory. There's several levels. At the dental office level, you're just running what we call some waived test. So let's take a look. If a dentist offers saliva test or an HbA1c diabetes test in the future, antigen test or antibody test, and so forth, the dental office can run in-office tests that have what we call FDA waived status. So the FDA has a list of tests that the dentist can do in-house. And so I want to emphasize, if you are doing testing in the dental office, you are this low-level laboratory, shall we say. So how would we report an in-office test? At this point, we have only the unspecified diagnostic procedure by report. It's for reimbursement. Again, it's by report. And so we're just not, at this point, it's just, we're at the beginning. We don't know. And my purpose is to put this on your radar screen because in certain states, it takes a while to get this certificate of waiver. And I'll talk about that on the next slide in just a moment. So for right now, what codes can we use? It's D09999. Now the ADA is releasing very shortly to the licensees the 2021 CDT codes. And there are 2 new codes that will be available starting next January. Could those codes, if you know what they are, be used now? No, they're not. So they cannot be used. So even if you find out about what the codes are, we'll be writing as a licensee. We will be writing about these codes and the ins and outs of them. But for right now, understand that there's no code between now and January 1. Starting January 1, we will have 2 new codes. So it's 0999 at this point. So what about this certificate of waiver, we call it? It is required. And so the cost of this certificate is $180. That's for 2 years. So it's a 2-year term. Now, some states require a separate registration. For instance, California, you've got to pay California $113 plus the certificate of waiver is $180 for 2 years. Now, every state requires the CMS Form 116. Now, the process of this, by the way, we have a resource for you. We have a number of articles, they're free. If you go to practicebooster.com, our website, up at the top of the website, you can look for our blog. I think we also are going to put a little flag there, and at no charge, you can look at some of the COVID articles. We've got articles on PPE, we've got articles on a variety of subjects right now. And so you can go to Practice Booster and see what the latest is. And we're trying to change those articles and checking about every week, is this article still valid? So how do you get the certificate of waiver? What you can do is Google State's Department of Health, go to your state's Department of Health, and then look for the CLIA department, CLIA department, and find out what your specific state requirements are. In North Carolina, I've talked to the people in Raleigh several times. They're claiming a 24-hour turnaround. So you can give them the CMS Form 116. They give you a CLIA number. You then go to the PayGov website and pay your fee, and bingo. So in North Carolina, the process is extremely fast. But other states, we're hearing as long as 4 to 6 weeks. So my purpose today is just to put this on your radar, to understand that this certificate of waiver has not been waived with COVID. It is not waived. You must have this certificate. You're acting as a very low-level laboratory in your office. We understand that the department is not making, coming in and inspecting you or anything, kind of like OSHA could come in, unless there's some specific complaint. And so at this point, check with your Department of Health. I'm hopeful that every state dental society would post your particular state's methodology for getting this certificate of waiver. It's not a big deal, but you've got to jump through some hoops. So you can go to practicebooster.com, you can go to the blog, and you can check for COVID articles. Okay, just a couple of items here. Our presentation is with Henry Schein. There is no CE credit today, as they indicated. I did want to make you aware that Henry Schein does handle our Practice Booster online system. It includes Insurance Solutions newsletter, and you can see the slide there and the item code, so talk with your Henry Schein rep. We also have Coding with Confidence, our code book. Henry Schein handles that. You see the item code. Also, we have our admin book. Folks, I can tell you, the administration area is the area that most dentists and most team members have less knowledge of admin. And let me tell you my own knowledge. We're in about the 4th edition. My first admin book was 200 pages. We're at 600 pages for this book, and we've still got landing pages. We don't have enough room to write in the book. And so we're learning every day more and more things about insurance administration. And Henry Schein has a bundle on both books. And then finally, We do have a book, a medical dental cross-coding manual. It's a monster. It's over 800 pages, and medical coding is a real challenge. And so we have a marvelous source here for you. So at this point, Adam, I want you to come back in. Also, Elaine is here to answer any questions, and let's just see where we are. And we'll do questions here for probably about 10, 15 minutes or so, whatever. So let's take a few questions.
Sounds good. Thank you, Dr. Blair, for all of that information. Before we get into questions, for those of you asking, yes, this is being recorded. We will send it out to you as soon as we can, and we will get you a copy of the PowerPoint presentation as well. All right, on to questions. We have lots of them. We had a few people asking about the teledentistry consent form and where they can find that.
Yes, you can get that on the ADA website. They have a COVID section there, and you can go, I think there's a direct link. Delane, do you have that direct link to the ADA website? It's ada.org/.
Actually, you can go to ada.org, and if you click on the COVID information, that's where you're going to find that template, I believe.
That's correct. So you get the informed consent on the ADA website, click on COVID, and then drop down. They got various COVID support materials there, and they have a coding section there on coding, and that's where it is.
All right. If you are 100% fee for service, can you still charge for PPE on a patient's insurance?
Yes, you can. If you are out of network, then you just put down your fee. If you want to charge the separate 1999 code, now they're not going to pay it. But since you're out of network, you do collect it from the patient. So it's, I would urge you to have some really good patient communication here. But if we're out of network, you've got two choices. You could either just increase the fee today. If your fee is $250 for, say, a filling, and you want to charge $260, $265, you inform the patient. Again, we want some excellent communication with patients where they are informed of what the fee is, or you could put it down separately. Here there is the chance that maybe it would be paid. And so there is the chance that 1999 might possibly be paid. We do see, I think, some positive trends, but again, there's not a lot of it at this point, but now it's a changing ball.
Can you combine the codes 9440 and 0140 together?
Well, I mean, you could charge a fee, but remember that your fee is going to be, in other words, I guess you could say if I come into my dental office, I'm going to see the patient. It's an emergency basis. I've got to open up the, I'm going to open up the building and everything. And all I'm doing is I'm going to write a prescription. Then my code 0140 might be $250. To show up under those conditions and do that. Remember, if I'm in a PPO, that the fee could be limited. So that after hours, I guess the question is, could you combine after hours fee plus code 0140 into one fee? If that's what the question is. Delane, do you have any insight on that?
I think that was it, Dr. Blair. I don't have any other comments on that one.
Okay.
All right, our next question. If I wanted to open my practice on Saturday for hygiene, can I use 9440?
No, you could not. If you're going to open up on Saturday and it's my normal hours, you cannot use 9440. Again, it's where the doctor, the intent of the code is it's after hours, and it means that I'm coming back. An example would be, say, Friday. My team and I work from 8 o'clock until 1 o'clock straight through. And then I go home, I'm eating a sandwich at 2 o'clock. I get a phone call. I've got to go back to the office and open it up. That's the intent of 9440.
All right. What is considered good reimbursement for code 0140?
I would say in the $100 range would be a pretty good reimbursement for code 0140. It does vary. Of course, New York City is one fee, and Alaska is a higher fee area. San Francisco kind of higher, Northern Virginia. So it depends really on the zip code, and insurance companies, they pay according to the zip code of where the service was rendered. That's why on the claim form that they've got the place of where the service was rendered. So I might be a pediatric dentist. I go to the hospital, it's in a better zip code. It may pay at a higher zip code than where my dental office is, or it could be the exact opposite. So the payers pay typically by a zip code, and certain areas it's way higher than others. So rural Alabama is going to be one fee, and then New York City, as an example, is a different fee level.
Besides audio and visual teledentistry, can phone consultations qualify for reimbursement?
Well, as far as what you bill out, according to the ADA website, just pure audio, you could not bill code 0140. They're saying that code 0140 has a visual and a audio component to it. So if I'm just talking on the phone to somebody and doing teledentistry purely by audio, then as far as we know, code 0140 would not be appropriate under those conditions.
If a patient has not signed the waiver, should you not charge the teledentistry fee?
You mean as far as the informed consent?
I believe so, yes.
Yeah, again, I can't give any legal, any kind of legal thing here. Just, I don't know. I can't really answer that. I think it would be good practice to do the informed consent, and it would be up to the dentist, as to whether they're going to do that or not. But I think it would be prudent too. They could check again with their malpractice carrier as far as the informed consent. Again, just as a pure layman, I'm not looking for a bunch of malpractice cases when a dentist is trying to do the best they can under the COVID teledentistry situation that we have.
You may have covered this, but maybe not. What should we be charging for PPE or the D1999 code?
Well, I see fees in the $10 to $20 range, and so that would be for that encounter. So I'm seeing fees $10 to $20. I don't think I'm seeing any reimbursements more than about $12 as far as reimbursements out there. But I would think that a $10 to $20 fee would be, roughly a fee range.
Can a teledentistry exam cover the exam requirements for a hygiene visit?
No, it cannot. And so we don't want to get into teledentistry with a hygiene visit. Its purpose is where we are, talking to a patient that's got a problem, or maybe we're visiting with a patient. Maybe I'm a dentist with Invisalign, and I'm contacting the patient. They hadn't been in the office for a while, and we're just talking, and they're talking about their aligners and this and that. I'm touching base with them. So, but as far as using the teledentistry coding in some manner, particularly within the office, or even code 0120 is not appropriate for teledentistry. A periodic exam over teledentistry in the context that we're talking about would not be appropriate.
Do you need to inform the patient that they'll be charged for a teledentistry visit?
I think they should be informed that there is a fee. If there is a fee, I think patients need to be informed of whatever it is. And so you could, it may be that the front desk, the business team is talking to the patient. Would you like a teledentistry visit with Dr. Blair? He'd be delighted. The fee for the teledentistry is $12. and then the exam is $90. And so I think the patient should be informed with good communication. You don't want a miscommunication here to upset the apple cart in your patient relations.
Would you be able to give us an example of what a PPE narrative could say?
You know, I sure can't. I wish Carson Carpenter was on here. So I'm sorry, I just can't give you a PPE narrative of what that would be. You would just describe that you're using a face shield and gowns and blah, blah, blah. So would be, the narrative.
Thought I'd ask. Give it a shot. Can you submit D9995 alone?
Yes, you could. You could just have a no charge exam and say, we're not charging for, if that's what they're asking, it could be a no charge exam, and I charge just $99.95 by itself. I guess the answer would be yes. If I wanted to do a no charge evaluation, I could.
All right. Well, we have over 100 questions left still, and we are out of time. So I apologize if we were not able to get to your question live, but I would like to extend a big thank you to Dr. Blair for answering all those questions and providing this presentation to everyone. And I'd like to thank all of you for attending today's webinar. We really do appreciate your time and participation. As a thank you for attending, everyone will receive a link to view the recording of today's presentation in the coming week via email. If we did not get to your question and you would still like an answer, you can email us at webinars@henryschein.com, and we will do our best to get you an answer as soon as we can. On behalf of Henry Schein, thank you, Dr. Blair and Delane, and thanks once again to all of you for attending. Have a great night.
Thank you very much. My pleasure. And if people would keep up with our blog from time to time and check the ADA website to see late breaking news on everything we discussed. Thank you.